But I was actually born and raised here on this island, not too far from our medical school, about maybe a quarter mile up the street. So very familiar with this area since I was a kid.
A kaka'ako keiki to the man who we believe to be the first Native Hawaiian inducted to the National Academy of Medicine. We celebrate Dr. Keaweʻaimoku Kaholokula.
My path to medicine, my path to health was really an unusual path, I would say. So it wasn't until like 5 years after I graduated from high school that I decided that I wanted to go to college, but not to get a degree in the health-related area or clinical psychology, where I got my degree in, my PhD. It was really just to learn the Hawaiian language.
Even before he knew he wanted to enter the field of medicine and give a voice to Native Hawaiians through research, Dr. Kaholokula was rooted in his culture.
Carol Silva was the kumu. She said, if you're really serious about learning the language, you need to go to the university. So I took her seriously, and I enrolled at Kapiolani Community College. As it turns out, I really enjoyed academics. I really enjoyed learning, and that's where my path began. And I had a very influential professor, psychology professor there, that I took courses from, who planted the seed in my mind that there was a need for Native Hawaiian psychologists.
Dr. Kaholokula remains a licensed psychologist, but he's devoted his career to advancing the health of Native Hawaiians and Pacific Islanders through research. It's a mission that started when he was an undergrad.
Dr. Kamana'opona Crab, who was a graduate student in clinical psychology at the time ahead of me, who basically introduced me to a research project, a Native Hawaiian health research project. It was an NIH-funded project at the time on both Kauai and Hawaii Island, looking at the epidemiology of diabetes and heart disease in our communities. I'd be forever grateful for that, because it allowed me to conduct my own research and collect data that was of interest to me.
That led to Dr. Kaholokula's first author publication. All while he was still an undergrad, he quickly realized the power that lies in research.
A lot of our policies and practices, decision-making, how resources are allocated is determined by, is data-driven. For a long time, our communities, Native Hawaiian Pacific Islanders, have really been masked or hidden their data because of the practice of aggregating us with Asian populations, usually, or the other category. And so our true health inequities weren't really known.
It's been Dr. Kaholokula's mission to unmask Native Hawaiian data, especially in the areas of health promotion and disease prevention, giving this population a voice and a seat at the table.
Having a seat at the table comes with a heavy kuleana, but the first thing I always make clear is there's no one person can represent our entire community. No way. I'm simply an aspect of our community, and hopefully I can bring voice or raise the issues.
Through clinical health psychology, community-engaged research, culturally grounded interventions, and community-based trials, Dr. Kaholokula has led JABSOM's Department of Native Hawaiian Health since 2011. He's been one of the principal investigators of JABSOM Center for Pacific Innovations, Knowledge and Opportunities, along with the Transdisciplinary Health Disparities Research Training for NHPI students, and the Cancer Research Education Advancement, Training, and Empowerment Program.
So when people say, how important is in culture in the work you do? It's everything. It's the reason I started this path, and the reason I even set foot on a college campus was really to learn the Hawaiian language. But over time, it was really to, how do we leverage our cultural assets, our cultural strengths, to further, to address the health concerns of our communities.
Local, national, and international awards line the walls of Dr. Kaholokula's office. But today, the collection of his work is being recognized as he's elected to the National Academy of Medicine.
I understand it to be one of the highest honors for a scientist in the U.S. And a recognition of not just the quality of their research and the impact of the research, but really, again, the service on a national level when it comes to influencing policy, healthcare, to our communities.
Dr. Kaholokula's work is not done. He sees this achievement as an opportunity to continue the important trailblazing work he's done over the last 3 decades.
But I do know that it's an opportunity for us as a community, right? It's an opportunity, again, to have a seat at the table. It's an opportunity to ensure that when it comes to national policies and practices around healthcare, and public health, that our community's voices are recognized or heard. I think the most important aspect of this, again, is that it opens the door for other Native Hawaiian Pacific Islanders to be able to serve and be able to have a seat at the table in this way. So I know that's a huge kuleana, so something I don't take lightly.